So we will start with the treatment of Pratishaya now. So the general line of treatment that has been given is first and foremost avoiding the causative factors, which is what they have said. So staying in a location which is not vata aggravating. So staying in a location which is not very windy, where you're not getting exposed to the wind, uh, or staying in such a manner where you don't get exposed to the wind. That is what is suggested. Then in the treatments, in the line of treatment that they have suggested, they have said Snehana, Svedana, Vamana, Dhuma, and Gandusha. That is the line of treatment they have given. So Snehana is oleation, Svedana is fomentation, Vamana is vomiting, Dhumapana is smoking medicinal herbs. So smoking medicinal herbs, and Gandusha is basically gargling. So these are the basic treatments that they have suggested. Covering the head with warm, thick woolen clothing is another thing that has been suggested. Then in the foods, Lagu Amla, Lagu is light, Amla is sour, Lavana is salty, Snigdha Anchas. Heating dry foods are suggested. So they have suggested foods which will be mainly, light to digest, Amla Lavana foods which are stimulating the Agni, Snigdha foods which are Anchas in nature, Ushna foods which are heating in nature, and dry foods. Now here they are not necessarily meaning foods which are drying in nature. By dry foods here, they mean that foods which will not increase the secretions. So foods which are not abhishandi in nature is what is expected here. So foods which are, because they will not suggest to eat unctuous foods also and dry foods also. Both cannot be suggested. When they say that you need to eat unctuous foods, they are not going to say you also eat dry food. So here, when they say eat dry foods, here dry food specifically means foods which are not increasing secretions have to be consumed. So if you look at the kind of foods that have been suggested, they are mainly the foods which will not cause any disturbance with the Agni, which will pacify the Vata. That's the idea behind the kind of foods which have to be consumed. Then ghee has been suggested in all cases except the recently formed pratishaya or in ama condition. So ghee is administered in all different types of pratishaya except for the new one, which is recently formed pratishaya, or in ama condition, ghee is not to be consumed. Svedana, Nadi Sweda or steam has been suggested. Nadi Sweda or steam has been suggested. Now all these, yeah, I'll come to it in 1 minute. So all these methods that are there of the treatments like Nadi Swed, Gandusha, etc., Dhuma, that you will be studying when Dr. Swapnil is there the next month in January. Practicals will be done for all of these, and you will get to understand, you will get to um, use them, try them out, and also practice them so that you can administer them later. Yes, Dori.
So, as Dekashi mentioned, the dry food, which I understood why dry food will increase the disease, but now we suggest dry food. So, um, what type of dry food can be administered in that case if it can still increase the vata?
In the causative factors, you mean? Or in the treatment?
Chikitsa now we suggest dry food.
Yeah. So I said that here the dry food, the meaning of dry food is non-abhishandi food, which is foods which do not increase secretions. That is the meaning of non-abhishandi food. So here, though they have said dry foods, The actual meaning in the textbooks is non-abhishandi foods, which is foods which will not cause increased secretions, foods which will not cause blockages in the channels, food which will not cause increase in the mucus and flame in the body. That is the meaning of dry food. So you can say that, the dry foods, because that's exactly what I said, that there cannot be opposite things suggested in treatment. Like you take snigdha foods also and you take dry foods also. That is not possible. So here dry foods is specifically non-abhishandi. Non-competitive foods which are incompatible should be avoided. Foods like dairy, etc., should be avoided. Foods like yogurt should be avoided. Foods which are fermented should be avoided. Foods which are, like tahini, etc., should be avoided. So those kind of foods which will increase secretions in the body, fruit and dairy should be avoided. So those kind of foods should be avoided is what is the idea behind this. Yes, Nicole.
Just wanted to know, no dairy, does that include just milk by itself? Because I know milk's such a good product for us, but would you stop milk? Say boiled milk.
So basically, what happens in these cases is when we are looking at pratishay, when we're looking at respiratory systems, giving milk is not a problem. Okay. But milk on its own can cause increase in their signs and symptoms because milk is naturally kapha increasing in nature. Okay. So if you have to administer milk, then maybe you will process the milk with, say, turmeric, for example, shunthi, for example, pipali, for example. So when you process the milk with certain substances, then that milk is okay to administer. But in general, if you administer milk for people who already have runny noses and cold and they are expectorating mucus, then milk will cause increase in these signs and symptoms, will add to the mucus and flame in the body and may aggravate the situation. Also, consumption, the time of consumption becomes important in all these cases. One is consuming milk, and also consuming milk at what time also is important. So even if suppose you are consuming milk early morning or uh, in the mornings or in the nights, then that is going to further cause problems. So I would say that milk as such is a problem. Okay, but if suppose it is necessary that the milk has to be consumed for some reason, okay, then what do, you will process the milk with certain herbs. You will add water in that milk and boil it with the, like for example, the way we do the kshirapaka, which is one part of milk, four parts of water, or one part of milk, two parts of water, and then you add maybe turmeric in it, saffron in it, and then boil it together so that you remove the water part. So the milk becomes also lighter to digest. Its tendency to increase the mucus reduces. Plus, you have added substances like turmeric, etc., which are beneficial for the problem itself.
Yep. Okay.
Same way, you can do it with people. So say one part of milk, you add four parts of water, two parts of water, maybe add half a pipali to it, boil it together till you remove the water part. So that milk will not just be nourishing, but it will also be rasayana because you are basically giving pipali along with that. And that is the only way you can give pipali, because pipali on its own, if you start giving powder of pipali, that will become too strong, too irritant for the person. So the best way to give pipali is processed with milk. So even though milk can be problematic to during respiratory problems, you will have to use it intelligently, whereby the milk doesn't become heavy to digest. It becomes in fact lighter to digest by addition of water in it. And then you process the herb with it so that it acts like a vehicle to carry the substance to the site of action.
Yeah.
Okay.
Thank you.
Yeah. Then Nasya and Vamana is also administered. Now see, I think one of the questions that Dr. Swapnil asked me is, which you had asked is that how are these products going to be available to us here? So um, see, there are two things which are important in this. Okay, one is there are certain products available in Australia, so you have to plan your treatment strategy around that. Number one. Okay. So say for example, the center has certain products. Other companies may have certain other products which you will find online in terms of what is available, etc. So you will have to plan the strategy around those products, because there is no point, planning something or uh, trying to understand something as a treatment protocol if that product or that medicine is never going to be available in Australia, for example. Okay. So, and second is certain therapies which you may not be able to give. Like, for example, Panchakarma. There is a limitation on how you can do Panchakarma, or to what level you can do Panchakarma, or what level of therapies can be administered. So we are not going to, uh, cross that line, which has been given to us by the government in terms of what should not be done, what should be done. So when I am teaching you, okay, or when I am referring to the therapies, I am only giving you products which I know for sure are easily going to be available in Australia. Okay, there can be, 10 other products which can be talked about or which can be explained in the therapy, in the chikitsa of each disease. But I am not talking about those, because then the question will be, where do we get it from? Where do you get it? How do you get it, etc., which is not going to be possible for you. And I'm not just talking about the center. What product center has is one thing. There will be other products also, or other companies also, which will have certain products in them. So, like for example, I remember Pedro showing me a website where there are a lot of Ayurvedic products available, etc. But there also there will be limitations in terms of what is allowed to be brought into Australia, etc. Because TGA, which is the Therapeutic Goods Administration, has a very clear regulation in terms of what can be brought in and what cannot be brought in. So there are certain limitations in that. So when I am teaching you, or when I am teaching you the chikitsa, I am teaching you the chikitsa within the parameter of what is going to be easily available for you. Okay. So that is how I'm teaching you, so that you find, or you have access to those substances, you have access to those herbs, you have access to those preparations as such, when you, if you decide to do the therapies, whenever you decide to do the therapies as such. That is what I am doing. Apart from that, one of the things which I am also planning to do is, um, once we go on a break this time, and we come back in the month of January, where we will have a couple of more lectures to do, because the content will require another couple of lectures to be done. So that time, but not covering it in the lectures, I am going to try and find out easy single herb preparations or combinations which can be introduced to you, which I can share in form of notes with you, which can be easily administered or used in the practice by you. What I mean is, like for example, if there are certain decoctions which can be made by combining 4 different herbs, which is given in some other textbooks which are not typically, studied in Ayurveda, which is like Vagbhat, Charak, Sushrut, etc. There are other textbooks which are also there, which explain use of single herbs, etc. So I will try and find out those also, and I'll share that list also with you, so that your life becomes easy in terms of using herbs, using products, finding those easily there, and trying to do the chikitsa with different single herbs available with you and combining them together and using them along with certain products which are readily available, which also becomes cost effective also, which also becomes practical also. Because if suppose you have if you have kept say 25 herbs with you, in those 25 herbs you can do multiple treatments, because you can combine 1 3 5 2 4 6 etc, and you can do the treatment. So I'm going to kind of do it in that manner where I will give you uh, certain formulations which would be more like decoctions or just powder combinations, etc., which can also be used for treatment purposes. Because Swapnil raised this issue with me that how are we going to deal with it in terms of availability, what products, etc., etc. Because in India, everything is available. So we can, if we look at, say, common cold, there can be a list of 20, 30, 40 different formulations that can be suggested, which can be found, which are found in the market, which are found over the counter in various pharmacies here, which can be purchased and also prescribed. But that is not possible there. So this is something that, we had a discussion about. So any which ways, I have, since day one, I have restricted my discussion to products which are easily available from my experience over the last few years, that, what is easily available, what is easily administratable, which is easy in terms of not causing any adverse effects on the patients also, because that is also critical. You don't want to administer something and land up into trouble because that medicine caused some problem with the patient. So that also has to be considered. So I'm trying to play safe here within the regulations as well as within the available products as such. Okay. So the last part is the Nasya and Vaman is also administered. So that is the next part. Now, then we go to specific, sorry. Then the treatment depends on two conditions. In case of Pratishaya, the treatment depends on two conditions: whether there is discharge happening from the nose or whether there is blockage in the nose. So based on this, the treatment will vary. Okay. In case of nasal discharge, Ushna Tikshna Kapha absorbing medicines are to be used. Okay. In case of nasal discharge, Ushna Tikshna, heating, penetrating, and Kapha absorbing medicines have to be used. What are the products to be used? One of the product is Hingul. Okay. Another is Aconite. Third one is Tribhuvan Kirti. Now, Tribhuvan Kirti is available there very easily. Okay. I want you to go back and research on these two first products which are mentioned here, which is Hingul and Aconite. Yes, Doreen?
Sorry, because you asked for research, but is it Ingul Inch, Jubashadi, or is it like, is it from Inch?
Sorry?
Is it from Asofetida? The Ingul
That
thing?
is Hingu. That is Hingu.
Same thing, or is it just with different way of saying, like in Sanskrit, or is it two different
No,
things?
no. This is a different
Combination of
substance
things.
altogether. No,
Okay.
different substance altogether. And I want you to research this, because when you research this, you will have certain questions on this, which we will then talk about, And the very reason I'm asking you to research this is because these two substances and a couple of more, which I'm going to ask you to research on, are extremely critical in terms of at least having an understanding that these are very important substances for treating respiratory problems. Whether they are available, can they be made available, will I be able to use them in Australia, etc., are different questions altogether. But as a understanding, as a part of knowledge, there are certain substances which you, if you don't have the information of that, then it is criminal not to have that information, I will say. And if I don't tell you that, these are the herbs or these are the substances which you should know about when you are treating respiratory system problems, not just Pratishyaya. And that is why research on these two products, Hingul and Aconite. Aconite, any which ways you must have heard that it is a herb which is poisonous, etc. So research that. We will talk about it a little bit more, when we come back. Will you be able to do it today? So we can talk about it tomorrow. Okay. So you will research on Hingul and Aconite, and we will then talk about it tomorrow more. Okay, but whenever there is nasal discharge, these two products have to be used or can be used. And the third product which is used is Tribhuvan Kirti. Tribhuvan Kirti is basically in form of tablets, it's a combination of certain herbs and certain minerals, uh, which is very, very commonly used for fevers and respiratory problems. Okay, again, a very commonly available product, very commonly used product. Okay, it is also available in the center. You can, you'll find it in the cupboards outside. So Tribhuvan Kirti, that is a product which can be used when there is nasal discharge, because this product or all these three will not just absorb the kapha, it will also help in correcting the problem of the respiratory system. Now, the second one, that another one which I want you to research is Bhallatak. It's a herb. Bhallatak is used in both conditions. It is used in the condition of nasal discharge also. It is used in the condition of nasal blockages also. Okay. Both these conditions, Bhallatak is used. How it is used? It will be used in form of medicated wine, Bhallataka Sa, Bhallataka Rishta, which is also a medicated wine, Bhallatak Parpati, like a preparation made from Bhallatak, and Bhallatak Siddha milk. So milk processed with Bhallatak. So it will be used in various of these forms, but this is something which is again a herb of utmost importance when we are dealing with respiratory systems, particularly conditions of recurrent colds, sinusitis, etc. Okay. So study these three, and then we will talk about these three tomorrow. They are not, please understand, these three are not a part of your syllabus or your curriculum, etc., because these three are difficult to get as herbs within Australia. But they are available in form of combinations, in form of formulations, etc. And that is why you should know about them. So, Bhallatak, Hingul, Aconite. Research all these three. Now, in cases of repeated tendency of Pratishyaya, Dipan, Pachan, Grahi, Dipan, Pachan substances are used, and Grahi, that is substances or formulations which are binding, which bind together with Bhallatak, like Sanjeevani Vati, can also be used. Okay. Now this Sanjeevani Vati is again a product which is easily available. It is available in the center also. It must be available in other websites or shops also, wherever there are Ayurvedic products available. Because it's a common formulation, I would say. Sanjeevani Vati is a substance which predominantly has been suggested as a formulation for digestive system problems. Okay, it has been suggested for digestive system problems, okay, mainly for diarrhea, dysentery, loose motions or stomach infections because of which are waterborne. So those conditions Sanjeevani Vati has been advised, but it is also used for Pratishaya for respiratory problem, for recurrent cold, because of its ingredient in it, which is Bhallatak, which I have asked you to research. Okay. Then for headaches, symptomatic treatment Nasya of ghee or Nasya of Anu Taila can be given. Okay. Nasya of ghee or Nasya of Anu Taila can be given. So simple ghee Nasya or Anu Taila. Anu Taila again is a medicated oil which is used very commonly for respiratory system problems, which is also used for a lot of other health issues like psychological problems, mental disturbances, stress, etc. So Anu Taila and ghee, these are two different substances given. So either you can use plain ghee Nasya or you can use Anu Taila Nasya for headaches as a symptomatic relief. So, and then Sarpagandha. Sarpagandha is a herb again. Okay, Sarpagandha is a herb again, which is given in the quantity of 125 milligrams with honey. That also reduces headaches. Okay, Sarpagandha is a herb which we are going to study. Okay, now this is a herb which is mainly known for its effect on blood pressure. Okay, it's a herb which is known for its effect on blood pressure, which is reducing hypertension, reducing the blood pressure. And so much so that even the modern pharmaceutical companies have now used the extract of Sarpagandha and they are developing products from Sarpagandha to control the blood pressure, to bring down the blood pressure. So it is not just an Ayurvedic herb which is used in Ayurvedic texts. It is also being used by modern pharmaceutical companies now to treat the condition of blood pressure, hypertension. Now, water consumption has to be controlled as a part of the treatment in cases of Pratishyaya. Water consumption has to be controlled. What does that mean? Excessive water consumption is going to result into this problem increasing, aggravating. Okay, people who have colds, sipping water repeatedly is not helpful at all when you are going through this condition. We usually keep a bottle of water and we keep on drinking it throughout the day. Okay, which is not advisable when you are suffering from common cold, or if you have a person who is suffering from common cold, has Pratishyaya, has secretions, mucus discharge happening through his or her nose, at the end also has other symptoms like fever, etc. Constantly drinking water, sipping water is not advisable, and that is why they have given it as a part of the treatment that water consumption has to be controlled. Now, like we said earlier, that water consumption, one, the quantity has to be controlled, or second, the temperature has to be controlled. So even if you suppose move from, consuming cold water to drinking warm water, that will also help in one, controlling the consumption of water. Secondly, it will reduce the adverse effects of water in the body. What does water do? Excessive water do in the body? Excessive water will hamper the digestive functioning. It will reduce your Agni. It will cause Agni Mandya. and then that will result into various health problems that happen in the body, which can be related to digestive system, which can be related to respiratory system, or any other system. So excessive water consumption is equally bad, just like eating excessive food is bad. Okay, so water consumption has to be controlled as a part of the treatment, or I would say move those people onto warm water. Whatever water they are drinking, ask them to drink warm water. That will reduce the water intake also. That will also reduce the adverse effects of water on the body, or water consumption will not aggravate the situation in these people. Now, specific treatments based on the types. In Vataja Pratishaya, Vataja Pratishaya was the one where there was blockage of the nose. There was, the secretions were very little in quantity, very light and watery in nature. So that's the Vataja type. There was pain in the temporal region. So that is the Vataja type. What is to be done in that? Ghee has to be consumed. Ghee is consumed as a part of the treatment. How much ghee will you consume? So approximately say 1 tablespoon ghee, couple of times a day as a part of the treatment can be consumed, or as a part of the treatment. Okay. So 1 tablespoon of ghee, maybe 2 times or 3 times a day can be consumed as a part of the treatment. Radish juice. Okay. Radish juice is suggested. Moong soup is suggested. Okay. Then there is a specific formulation given, which is Pippali, Dashamula. Dashamula is the 10 different roots which are suggested in Ayurveda. Okay. Shunthi, that is dried ginger, and Eranda, which is castor. Eranda is castor. So these plants are processed with milk, and that milk is consumed. So milk processed with Pippali, Dashamul, Shunthi, and Eranda is consumed as a part of the treatment. Now the Dashamula, which are the 10 different roots which have been explained in Ayurveda, these roots predominantly, the 10 roots, the Dashamula, you will find that these roots have been combined together into a group called Dashamula, and all of these 10 will be used together. Which conditions they will be used together? These Dashamula are predominantly Vata pacifying. This Dashamula is anti-inflammatory. These Dashamula are analgesic in nature. So these Dashamula will mainly be used in conditions of pain, in conditions of stiffness, in conditions of constipation, Vata aggravation. Those conditions, this Dashamula will be used. Are there any formulations available specifically made from these Dashamula? Yes. There are oils available which are processed with Dashamula. There is a wine available called as Dashamula Rishta, which is specifically made from these 10 herbs, okay, 10 roots. The purpose of this is that it is mainly Vata pacifying in action, a strong Vata pacifying group of herbs is what you can say. Then certain nasya is suggested, nasya of apamarga bija and saindhava salt. Saindhava is rock salt. Okay, saindhava is the black salt basically. So the black salt nasya with ghee has been suggested. Then there is a formulation which has been suggested called Samir Pannaga. Okay, this is not available, or this will not be available in Australia, because it's a very, very one, expensive and very difficult product to make. So this Samir Pannaga is the product of choice for Vataja Pratishaya. And that is why I have explained it here that, this is something which is used mainly. Then whilst looking at the foods, etc., Snigdha, Amla, Ushna, Lagu substances are consumed. Warm water for drinking and bathing. So warm water is suggested for drinking and bathing. And anchas, sar, heating and light substances are consumed in the meals. Now, Pittaja Pratishaya, again, ghee has been suggested because ghee is good for Pitta as well as Vata because of its anxious nature and because of its uh, oiliness in it. So, ghee is suggested. Cooling substances for Pradeha and Parisheka. Pradeha is lepa, application of paste on the body, and Parisheka is dhara, making a decoction or infusion flow on the body in form of dhara is parisheka. Okay, so cooling substances are used for pradeha and parisheka. Where will they be used? They will be used on the forehead, they will be used on the head. So pradeha and parisheka, cold substances are used, cooling substances are used. Then madhura, shita and kanthya substances are used for decoction. Madhura is sweet, Shita is cooling, and Kanthya is good for the throat. These kind of decoctions, these kind of substances are used for Kavala. That is, what is Kavala? Holding the decoction in the mouth for a particular time till you cannot hold it any further and then you spit it out. So basically, Kavala is holding the decoction or liquid in the mouth. Madhura, Shita, and Kanthya substances. One of the best examples of sweet, cooling, and substance which is good for the throat is licorice. Okay, one of the best examples of this is licorice. So licorice decoction can be used for Kavala. Another formulation is I have given is clove, vetiver, sandalwood, black grapes, that is black raisins, licorice, honey, and sugar. Kwatha is made and that is used for Kavala Graha. That is used for Kavala, that is holding in the mouth. Then mild virechana, that is mild laxative using black raisins or aragvadha is used. So black raisins can easily be used. So black raisins, mild virechan is given. Now, black raisins is a very, very, very effective way of using mild laxative. Okay. Whenever you feel that there is a problem where you need to give virechana, where is virechana given?
Where is it given? Like why?
Which conditions you
If
will
you've
give
got excess pitta, like say you,
excess pitta. So Virechan is the choice of treatment when there is aggravated pitta in the body. So that is the method to remove excess pitta out of the body. Correct. Now, when we say excess, now excess is something which is also relative. Okay. But if you feel that the doshas are aggravated so much that if you start giving them medication to pacify the doshas, it is going to take a very long time for the pacification to happen. In those cases, you administer Virechan, Vaman, etc., the Panchakarma. So a Virechan is something that can be easily administered by you in Australia also because that doesn't really require medical supervision. You're not introducing something internally like you do in MSCs, etc. You can just ask the person to consume substances in the night which you want to give as laxative, and the next day morning or the middle of the night the person will have a couple of bouts of feces and virechana, and the person will be fine. So mild virechana is given, and that's the easiest way to give mild virechana, mild laxative, is use of black raisins. Black raisins are excellent for virechana, mild virechana, and they can be used very effectively for various conditions. Say, for example, Pratishaya, in this case, they have said give mild virechana. It can also be used for skin diseases where there is pitta disturbance. It can also be used for, liver disorders where there is pitta aggravation. So all these different conditions where there is pitta aggravation, mild virechana can be given to control or to bring the pitta in control very quickly and very effectively. And black raisins is one of the easiest ways to do that. How do you use black raisins? Basically, you can ask the person to consume black raisins with warm water in the night. Okay, or you can soak the black raisins in water and ask them to consume that, eat them, and drink warm water over it in the night. That will act like a mild virechana. Now, obviously, when I say that it's a mild virechana, you will not be able to administer it to everyone because there is a concept of koshtha, right? You understand the concept of koshtha. Some people, they require really, really very, very strong laxatives to even have softer bowels. Some people, they require very, very mild laxatives for loose motions to happen. Like, for example, some people, even if they just consume ghee in the night, next day they will have a couple of loose bowel movements. So their koshtha is very, very delicate, very, very light. So they will have loose motions, a couple of loose motions just with ghee. Some people, even if you give Gandharva Haritaki or castor oil, they will not have any loose motions or softer bowels. In them, the koshtha is very hard. It is very, very difficult for these people to undertake laxatives. You need stronger laxatives to be given. So understanding of koshtha is important in terms of the choice of herbs or choice of products to be used as laxatives. So black raisins, it's a mild laxative and will obviously be used for people who don't have a very strong koshtha, very hard koshtha. Okay. Then another substance is Vasa avaleha. We are going to study this herb Vasa, which is called as Adatoda vasaka in Latin. That is a herb which is used for various respiratory problems. It is also used for various blood disorders. We are going to study that herb. And an avaleha, which is a marmalade made from that herb, is used as a product. And treatment for Rakta Pitta in cases of bleeding from the nose. So basically, have you studied Rakta Pitta with Swapnil? So what was the basic concept of Rakta Pitta treatment? Basic concept. What is the basic idea? You need to unmute yourself, Deka.
So talking with the colleagues, we're trying to reply your question here in between us.
You're having a discussion and then answering the question. Okay. So what is the basic line of treatment for Rakta Pitta?
I would say maybe aloe vera, for example.
No.
Well, I'm reading the notes, huh? I'm sorry, it's well, it says Vilechana with Kashaya and Tikta rasa herbs, which has the Ragwar, Aritaki, Amalaki, Resin, Yashtimadu.
I'll tell you what, the basic concept of Rakta Pitta treatment. What is Rakta Pitta in the first place?
Hemorrhoid
Hmm?
or hemorrhagia.
When like Rakta and Pitta has gone up too much.
Yes, and what happens in that?
Oh, bleeding. That's right.
Bleeding. So the main symptom of Rakta Pitta is bleeding. Correct. Depending on where the bleeding is happening, whether it is happening from the upper orifices or whether it is happening from the lower orifices, you will call it as the Urdhvaga Rakta Pitta or the Adhoga Rakta Pitta. That is bleeding happening through the upper orifices or bleeding happening from the lower orifices. Correct? Right. Now the basic idea is that who is driving this to happen? The Vata is driving it, right? If the bleeding is happening through the upper part of the body, the Vata is taking that blood and bringing it out of the body. The bleeding is driven, stimulated by Vata. In the same way, if the bleeding is happening through the lower orifices, that is also because of Vata. Correct. So the basic line of treatment in Rakta Pitta is changing the direction of Vata in the first place so that the bleeding stops. Are you understanding what I'm saying? If the Vata was bringing the blood out of the body through the upper orifices, which may be nasal bleeds, okay, if it was through the lower orifices, which might be, through the anal region or from the urinary tract, then what is happening? The Vata is acting in the downward motion or the Vata is acting in the upward motion. So if you want to stop the Vata to cause the bleeding from upper orifices, the movement of the Vata needs to be changed. And that is why whenever there is bleeding through upper orifices happening, usually a laxative is given whereby the Vata changes the direction and starts moving downwards. The moment the Vata starts moving downwards, the bleeding stops from the upper orifices. And in opposite cases where the bleeding is happening through the upper or lower orifices, a treatment like vomiting is given, emesis is given, where the direction of Vata again changes and it starts moving upwards, stopping the bleeding happening through the lower orifices. So the basic concept here is changing the direction of Vata. Once you stop the bleeding, then you have time to deal with the treatment with herbs, medications, etc. Now, why this is important that the bleeding has to be stopped? The bleeding has to be stopped because blood or Rakta Dhatu is one of the most important dhatus in the body. If bleeding is happening constantly, there is going to be Dhatu Kshaya happening, depletion of tissue happening, weakness is going to come in, the person is going to get debilitated, and that is why as an immediate thing, as a first measure, you need to stop the bleeding. And for that, yeah, I'll come to it. Give me a minute. And for that, you either change the direction of Vata or you use substances which will stop the bleeding. Either of that can be done. Now, the easiest is, changing the direction of Vata if you cannot do anything. So give a mild laxative in case there is nasal bleeds happening. give a mild vomiting where the direction of vayu changes, the bleeding through lower orifices stop. Or then you can use herbs which specifically will stop the bleeding through particular areas that are happening there. Okay, Doreen, go on. Ask the question.
In my notes, it says depend of the strength of the patient, the blood shouldn't be stopped immediately. Is it my mistake or is it?
No, that's exactly what I'm saying. That depends on the strength of the patient, but it is important that you stop the bleeding, right? You cannot, for example, you are giving medication to the patient, which is for Rakta Pitta treatment, but the person is losing blood every day. Suppose you keep on giving the treatment for 2 months, the person is simultaneously losing blood every day because the quantity of blood may reduce gradually, but the basic symptom or basic sign of Rakta Pitta is what? Bleeding. So the important aspect is how do you stop the bleeding? The bleeding has to be stopped because that is the most important symptom. Otherwise, the person is going to become weak every day. So if the bleeding is not too much, like it's a nasal bleed, right? For example, sometimes people have nasal bleeds in summers. What do? A simple remedy like, smelling the onion can stop the nasal bleeds. You don't have to give a laxative in those cases. But if there are recurrent nosebleeds happening every day, and even these kind of remedies in these kind of treatments are not working, then you need to do something which is going to basically stop the bleeding. So strength of the patient 100%, but at the same time you cannot let the blood be lost whilst you are doing your herbal remedies and your herbal treatment, giving them ghee, giving them aloe vera, giving them licorice, giving them vasa, whatever is advised in the textbook. So changing the direction of vata has been advised in a lot of times as a part of the treatment. Is it normal to change the direction of vata? It is not normal because you are changing the functioning or you are interfering with the functioning of a dosha, so to say. But it is important to do that sometimes because what is the principle? Treat the disease first, deal with the disease first, bring that person back to a state of balance, then we can deal with other things which are minor issues to deal with. Clear? So this, a lot of times you will see that they are suggesting that change the direction of vata. Changing the direction of vata. Should I join you, Decca? There is some important discussion happening there, I think. Huh?
No, we're just wrapping up. So yeah. So in case, for example, of the bleeding nose, then you smell oil. If it persists, then maybe you should provoke a mild virechana to change the thing is the
Anulomanam. Yes,
the word.
anulomanam. Yes,
And
anulomanam.
yeah, and then in the opposite, we were just discussing case of hemorrhoids, bleeding hemorrhoids. So maybe provoking a mild vamana
So
would help.
I wouldn't say that. See, I'll give you an example. Okay. I had a patient, and I actually dealt with it on the phone because somebody called me randomly and said that I my relative is unwell, is having cancer, okay, and is having lung cancer and is constantly coughing, and every time the mucus comes out, there is blood in it. Now, please understand that Rakta Pitta as a condition, when we look at it, it will present in different forms. This is also kind of Rakta Pitta. So it is not going to be hemorrhoids necessarily. a person will just pass blood with urine. It may, or he or she may pass blood with stools. So when people have colon cancer, what happens? When there is colon cancer, the stools are black in color. Why they are black in color? Because it contains blood. So when we look at a condition, do not, limit yourself to, something like nosebleeds or just hemorrhoids. These are very obvious conditions.
Yeah, we understand we were saying that, but so generalizing, we're just giving an example. So in all those conditions that you mentioned, so that means that provoking a mild Vamana would be beneficial. So we like change the direction of the Vata. Is that it?
That's what has been suggested in a lot of cases. Like for example, in Rakta Pitta, you will find that for Adhoga Rakta Pitta, Vamana has been suggested. For Urdhvaga Rakta Pitta, a Virechana has been suggested. So, but in this case, for example, this person that I am talking about, they called me and said that she is having cancer of lungs and she is coughing, and every time she coughs and expectorates, there is blood in the sputum and a lot of blood. So then that means the bleed, already the person is having cancer, already there is dhatu kshay, there is serious problem, and then if the person every time coughs is throwing out blood, it's further damaging to the person. So obviously I had to do something in those cases. So I on the phone I told them that you do two things. One is I asked them to take black raisins, which is mild laxative, which will change the direction. Number one. Also, it is good for blood because black raisins are excellent for Rakta Dhatu. They nourish the Rakta Dhatu. They increase the quantity of Rakta Dhatu. So even though the blood loss is happening, you are also nourishing it at the same time. And the second thing that I gave them was Vasa, which is Adulsa, which is Vasaka Adatoda. Now, Vasaka Adatoda, which is the name of the herb, which is called as Vasa, is one of the best herbs suggested in Ayurvedic textbooks for bleeding through upper orifices. Apart from its action on the respiratory tissues or respiratory system diseases, Vasa is one of the best herbs for bleeding through upper orifices. Now, when you have a herb which is available there, so there is a cough syrup that is available in the center, which is called as Vasocin. Okay. Now, what is that? That is a cough syrup. And then there is a product called as Sitopaladi Churna, which is basically sugar with some spices in it. So I just asked to take this Vasavaleha, which is basically Vasocin, which is a cough syrup, mixed with Sitopaladi Churna nearly 7 to 8 times in a day. The idea was to give Vasa internally as many times as possible to stop the blood being thrown out with the sputum. And it really gave very good results because consuming Vasa in form of Vasocin with Sitopaladi, it also helped in stopping the bleeding, and also the mild laxative black raisins that also help. So sometimes you may not have specific medicine for the condition, but if you know the ingredients of the medicine, then you can use a different formulation for some different use completely. Okay, so understanding of the herbs and understanding of the formulations in terms of its ingredients is important for this purpose, that it helps you use the medicines in a bigger spectrum than what is suggested in the textbooks or what you are studying as such as a product or as a formulation. Next one, Kafaja Pratikshaya. This is usually presented with ama in it when there is ama presence in this condition a lot of times. So Langana, that is fasting, is given. Kapha reducing herbs are used. The decoction of kapha reducing herbs and Swedana Parisheka. Are you sorry, the kapha reducing herbs in form of decoction are used for fermentation in form of Parisheka, which is dropping or flowing the water or dhara of the decoction on the body. Can you tell me kapha reducing herbs, a couple of them?
Pipili,
Turmeric.
Turmeric, yes.
Yeah.
Ginger. Any more? Yes. Pipali, turmeric, ginger,
Cinnamon.
cinnamon, yes.
Tulsi.
Clove, tulsi, yes.
Ginger. Clove. Cumin. Mustard.
Okay. So, kapha reducing herbs in form of decoction is used for Swedana Parishek, that is, dhara on the body. Mustard seed paste is applied on the forehead, eyebrows, nose, and the sinuses. So, mustard seeds paste is applied because it is heating, it is kapha pacifying, it is also liquefying the kapha, which helps in removing of the mucus easily. Vacha Taila or Vacha powder is used for Nasya. Vacha is Acorus calamus. Okay, calamus powder. Acorus calamus powder is used for Nasya, or the oil made from Vacha, which is Acorus calamus, is used for the Nasya. We are going to study this oil also in the formulations. So that is used for Nasya. Now, when we talk about Nasya, we have said that you can use oil, ghee, decoctions, milk for nasya, but you can also use powders for nasya. Okay, so this vacha is one of the herbs which is used in form of powders for nasya, and that is mainly used. Vacha is mainly used for stimulating the brain, stimulating the majja dhatu, used for conditions like epilepsy. You know, conditions where the person has fainted, the person has lost his consciousness. So in those cases, vacha powder is used in form of nasya to bring the person back to his senses, make the person become conscious again. So that is vacha powder. Very, very strong nasya. It is only used in very few conditions, but oil of vacha is used commonly for various health problems, I would say. Again, mainly dealing with the brain and the conditions of the brain, like epilepsy, or in conditions of bipolars, etc. Okay. Then in Sannipatik Pratishaya, which is all the three doshas, Katu Tikta, that is pungent bitter herbs, are used with ghee for Nasya. Dhumapana, that is smoking is used in form of Tikshna Katu Ushna herbs. Substances like Katuka. This is a herb which we will study mostly today. Katuka, which is Picrorhiza curio, that is used. Mustard is used. Vacha, that is Acorus calamus, Pippali, and Ajmoda. What is Ajmoda? Still studied in year 1, Ajmoda. Okay. Put down in your notes. Go and find out what Ajmoda is.
Celery.
Celery. Sorry. If you put yourself on mute and go on talking there, I can't understand you guys.
Celery.
All I can see you is making funny faces, laughing, smiling, jumping there. So that, yeah. Celery. What is it used for? One use of that.
Digestive and expectorant.
Yes, digestion expectorant. Good. At least the group will pass the exam. So, Katuka, mustard, Vacha, Pippali, Ajmoda, the Kwath, the decoction is used for Kavalagraha. Internally, licorice, Rakta Chandan, which is the red sandalwood, processed with milk, is consumed internally. And treatment is based on the dominance of doshas because Sannipatik, which is all the 3 doshas are disturbed. So, based on which dosha signs and symptoms you see dominantly, you will choose the treatment from the Vataja, Pittaja, Kaphaja type that we studied earlier, and accordingly you will do the treatment. Raktaja is similar to the Pittaja Pratishaya. Now, Dushta Pratishaya, all 3 doshas are disturbed in this. Kapha Dushti is more, followed by Vata and less Pitta Dushti. This condition can only be controlled by treatment, and hence treatment is done for many days. Dhatuk Shaya, that is depletion of tissues, and Krimi, that is infection. Krimi means worms. But here, as I have always said, that Ayurveda has used the word krumi, which means worms, but Ayurveda has also explained worms which are visible to the eyes and also visible to the microscope. So it all talks about microorganisms also and macroorganisms also, so to say. So it includes both worms as well as microorganisms which cause infections. Okay, so when we talk about Dushta Pratikshaya, it is primarily, not just the maggots which will be seen in some cases, it also refers to the infections of the respiratory tract, infections of the sinuses. I mean, infections of sinuses are so common. People having infected sinuses, swollen sinuses, where the flame is stuck into the sinuses, causing heaviness, pain, etc. What are sinuses? What are sinuses?
Nasal passages, like up here, in the nose area, that lead to your maybe throat and eyes.
What are sinuses? Yes, Deka. You're talking to me, talking to the group there.
It's related to ASTI, no? Hollow spaces on the head structure of the ASTI dhatu that allow the air to go through, like make the channels.
So some part of the answer is correct, but some part is very confusing. So these are basically hollow spaces in the skull, okay, in the skull, which are around your nose, around your nasal passages, okay, which are connected to the nasal passages, okay, which contain mainly air. So there are sinuses which are frontal sinuses. There are sinuses which are next to the nose, which are called as paranasal sinuses. So these are hollow spaces in your skull, bony structure, which primarily contain air. But what happens is when there is cold, when you suffer from cold, when there is a lot of mucus, then sometimes these sinuses also get filled with mucus or phlegm. Or sometimes these sinuses also get infected. Because this nasal passage is directly connected to these. So when they get infected, when there is, mucus there, then they will get swollen, they will get painful, they will get heavy, and these sinus infections or inflammation is very common, which we call as sinusitis. A lot of people who suffer from colds also say that I have recurrent sinusitis. What is sinusitis? Inflammation of sinuses. By what? Inflammation of sinuses by basically mucus, inflammation of sinuses by mild infections there. So that is what is sinusitis, which is a very common condition seen in a lot of people. Always starts with common colds and just runny noses, etc. But if the condition is not treated, if the person doesn't treat them properly, then there is a tendency that this infections or these conditions may spread into the sinuses, which is not the normal area, normal position for these infections to spread or the disease to spread. And then if it goes there, then the condition can become more serious, condition can become difficult to treat, condition can become more, problematic, more painful, etc. And that is why the dushta pratishaya, which is the infected, rhinitis, which is or cold, can become problematic because it will then spread to the sinuses, cause infections there, etc. So, like we said, dhatukshaya, that is depletion of tissues and worms, is an important aspect of this condition. And dealing with the sinuses also becomes important because a lot of times this condition is most likely spread into the sinuses also. And hence, substances like, haridra, musta, shunthi, karanja, mixed with goat's milk yogurt made into a ghee is used for snehapana. Basti is also used. Asavarishta, the bhallataka sav. You're going to research this herb and come back tomorrow. That's when we will talk. And Sanjivani Vati, again the product that I explained earlier, Sanjivani Vati, Bhallatak Parpati, Shrunga Bhasma, that is the deer horn bhasma. So deer horn made into ash bhasma is used as one of the best treatment for dushta pratishaya, that is infections. Okay. But Sanjivani Vati is important. Sanjivani Vati, which is used for infections, which is used as, for this condition, dushta pratishaya. The pathya, what is to be consumed? Snehana, Swedana, Shiro Abhyanga, that is head massage, old rice, moong dal, eggplant, moringa, radish, garlic, warm water, honey, meat of animals living in dry regions, and Ushna Lagu Snigdha diet is suggested. What is apathya? What is to be avoided? Bathing, anger, suppression of natural urges, grief, excessive liquid foods, and all causative factors which cause pradishay have to be avoided. Okay, that is the pathya and apathya. So mainly light foods, foods which do not, which are easier to digest have to be consumed. And obviously consumption of water, excessive, you know, yes, yes, Dory.
I'm sorry, but I thought that eggplant will be contraindicated for any kapha person condition.
Why? Because it is kapha increasing.
Yeah, I think it's what I remember. So why would it be pathya in that condition then?
So eggplant basically, they have given it in the list of pathya that is given in the textbook as such, the original text, etc. Now here, eggplant, when you cook, you grill it, you process it in a certain way, mix with spices, then probably it may not be, as difficult to digest, etc. But if we feel that eggplant is problematic, you can always get rid of it. I am giving you the list of herbs which is in the textbooks originally. So the reason I will also check, I'll also maybe, find why eggplant is given there. I'll also talk to some people and see what is the reason they have given eggplant. If there is any specific reason for that, I'll come back to you. Okay. Okay, so yeah, we'll stop for a break, lunch break, and come back in an hour. Okay, and after this, we will study some herbs today, and then we will continue tomorrow. Tomorrow, everyone is going to be present. I hope you have planned your days already. Teka is already saying no.